Welcome, everyone. Hi, I think I know most everyone, but for those few I don't, I'm Jody Heymann. I'm Dean of the Fielding School, and it's an enormous pleasure to welcome you for an extraordinary evening. This is the evening we get beginning tonight and on all future nights to honor Paul Torrens by naming the Health Forum the Paul Torrens Health Forum at the UCLA Fielding School of Public Health. Paul, it is so incredibly wonderful to be here with you, with your wife, Jackie, one of our alums, and with the many people in the audience here who you have mentored and whose lives you have transformed and in turn transformed the lives of others. Before I dive in for a minute about your extraordinary career, I would just like it if anybody here who has been mentored by Paul and then in turn mentored anyone else, please stand up. Yeah. Stay standing for a second. Take a look, Paul. There's a phrase in medicine, and many people know my first training was in medicine, but there's a phrase, a doctor's doctor. And a doctor's doctor, that's who you really want to go see. Paul, you are a mentor's mentor. When I look in this audience and the number of people I know who are running large hospitals, running large programs, running large companies who in turn have just mentored dozens, hundreds, thousands, but who were mentored first by you. You just feel the generation after generation that you've transformed. And I know by people nodding their heads how much we all know that's true. I've had the fortune of working at several great universities, and at each of them, at Harvard, at McGill, at here, I've spoken to many students, and at UCLA, we have many incredibly dedicated faculty, extraordinarily committed to teaching. But there is no one for whom more people have come up to me from the health system and said, there's one person, one reason why I'm here, one person who really transformed my career. And that's you, Paul. So can we all just have one more recognition of that? So Paul's incredible passion for and ability to teach and inspire students so that they move through the world with more knowledge, more compassion, and more care, then in turn become mentors themselves, has truly created a generation of leaders in the healthcare system, and then in turn, another generation. We are forever grateful for his 44 years and counting of mentorship, research, writing at UCLA. His legacy is felt through the students directly, I think, most in a way that has most transformed lives. But it's also the case that if you say he wrote the book, yes. Paul literally wrote the book on health services, The book, Introduction to Health Services, is now in its 7th edition. So there are just thousands more. Who aren't here today that we just know the reverberations in their careers are immeasurable. Ultimately, that reverberation, though, is in the millions who have received health care that has been transformed by what you've done here. The forum is designed as a lifelong learning vehicle because healthcare is changing so fast that all of us need to continue to learn. It's designed to be open for faculty, students, alumni, community members, staff, experts, friends. Given that it's a way for us all to continue to learn and to continue to deliver the best care that can be delivered, I can't think of a more perfect way of honoring Paul than to name it the Paul Torrens Health Forum, to honor his teaching, honor all we learn, and honor the transformation in health. I want to thank everyone who has supported the Health Forum over the years in so many ways. The list is long, but I want to mention, knowing that there are many more of our alums, of community members, and Paul's former students. 3 of Paul's former students, Artie Southam, Jack Schlosser, and Richard Sinaiko, for their incredible generosity, and that for so many more of you who are here in the audience, and I hope people came in time to see the names of everyone who contributed to honoring this, the Paul Torrens Health Forum. So I just want to close by saying, before I turn it over to a video, on a personal note, some of us have had enough health bumps in the road of life that we've known what it's like to actually say, what did I do that I really cared about? And that happened to me when I was 29, and the thing I focused on was I could think of one child that I was pretty certain was alive because of something I did that no one else would do. And that wasn't much, but at least I could hold on to that one child. What strikes me, Paul, is how many lives you have transformed and continue every day, every week to transform. And in this audience, I think we're going to end by them standing again, then we're going to go over to a video and you're going to hear from many of them. But life after life where you transformed again, mentor of mentors, and through them, generations and generations. So thank you so much for all the work you have done.
He inspires people. He brings people together.
He really captures the essence of the quality of teaching, of education, and that personal touch, which is Paul Torrens.
I've been at UCLA since 1972. This picture is 1974, and it's a teaching award from the Public Health Alumni Association. Here's the plaque 40 years later. I keep it where I can see it because it reminds me of what I should be doing. My goal has been, as a teacher, sharpening the skills of our students.
What makes Paul a great teacher is, first, his just genuine interest in the students. He's interested in seeing them grow and develop, not just as professionals, but as people.
We've known each other for more than 30 years. During my first meeting with Dr. Torrens, the first thing he did is he asked me what I was about. What are you interested in? I'm sure there's no one else in all of California or American healthcare who has touched the lives of so many people. That impact is everlasting.
Whatever I've contributed here at Cedars-Sinai has been, I think, a direct outgrowth of the relationship I've had with Paul.
I've never had a single day where I've said to myself, I'm doing the wrong thing. And if you can say that after 40 years, that's pretty terrific.
He has always been the person that has fostered strong relationships across the entire community.
The Health Forum is what a great public university should be doing more of, bringing together people from the community, faculty, students, alumni, in a public forum to hear about latest developments, to have different opinions shared, and literally in a protected place have open discussion about the important issues of the day.
When you have the health forums, you're able to bring together leaders in the field. And Paul just, he's the maestro. He's able to conduct this symphony and make beautiful music in terms of bringing everyone together, looking at the commonalities, but also striving for innovation and changes and good things for people in society.
And that's the best thing. Something lasts.
Good evening. It is my distinct honor to have been asked to introduce our guest of honor, Dr. Paul Torrens. Like so many others of you in this room, it is because of Dr. Torrens that I have had an incredible 40-year career in healthcare management. Paul has been a teacher, mentor, and colleague and friend, as you already have heard, for the last 40 years, and a key link between the Fielding School of Public Health and the Department of Healthcare Policy and Management with the healthcare industry of Southern California. Paul, the time and effort you have devoted to support your students and the school, along with your ability to connect with the entire spectrum of the industry, and not only connect, but to sustain those relationships for the past 40 years, is truly remarkable. I happened to find a quote from another very highly regarded UCLA faculty person named Norman Cousins, and he said, quote, "If something comes to life because of you, then you have made an approach to immortality. It is with great joy and pride that we honor you this evening." Dr. Paul Torrens.
We have a program to put on tonight, so we'll make this brief. I don't even know where to begin. And all I can say is thank you very much. Sorry, I'm going to lose it. Thank you very much for making my life so rich and full, because it works both ways. And I'll take all the credit that you want to give me. It's been that kind of economic market, so, But it's worked both ways, and I have received so much that I can't begin to say how much it means to me to know and work with and be involved with someone like Richard for so long and still be friends. Although there are things we could talk about and, not serious, but there was that one. Anyway, I'd like to thank you all for coming and for being good friends. and hope that you will continue to be friends of this school and department and this forum, because these are special places, special good things in the middle of a busy world that will continue to thrive only if good people like yourselves continue to work at making it happen. So that if you really want to do something nice for me, continue to support this program, these forums, this sense of purpose, of public purpose of a great university and a great school. Thank you. I should, before I close, give thanks to my wife and partner in life, Jackie. Who has to put up with all this stuff and with me, and does it happily and positively and makes everything possible. Thanks, Jackie. Thank you all. Avram, we do have a program tonight, and I'm sorry for our guest speakers that we've taken so much time out of your program. I hope you'll speak fast. And the person who put the program together, Avram Kaplan.
So well deserved. Thank you.